So this video is the part 2 of your physical examination on general survey, vital signs, and pain. Okay, so let us proceed to taking the heart rate of your patient. Okay, so let us proceed to the heart rate and rhythm. So in taking the heart rate, the commonly used is the radial pulse. Okay, wherein you have to locate your radial pulse using your index and middle finger. Okay, yeah. So if the rate is unusually fast or slow, you have to count it for 60 seconds or 1 full minute. Okay, so the normal range for adult is 60 to 100 beats per minute. So part of your taking the heart rate is to observe also the rhythm. Is it regular or irregular? So if you notice irregularities, make sure to assess the apical pulse. So using your stethoscope, you have to place your stethoscope on the apex of your heart or at the fifth intercostal space, mid-clavicular line. Okay, left side. Do early beats appear in a regular rhythm? You have to compare it to breathing. So, regular, irregular, or irregularly irregular. Okay, if you noticed, again, irregularities, you have to obtain or check the ECG, okay, if there is presence of irregular rhythm that is detected through ECG. Of course, ECG is usually ordered by your doctors. Okay, this is where you can locate the apex of the heart. Okay, so this is the apex of the heart on the left side of the body, wherein you have to place your stethoscope. It is located at the fifth intercostal space, mid-clavicular line. So this video actually shows, okay, the sounds of the heart. Okay, but again, this link will be posted on the canvas. So in taking for the pulse rate, this is where you have to place your middle and index finger and count the pulse rate for 1 full minute. Again, observe for rhythm. Okay, so right after taking the pulse rate of your client, you can now proceed to counting the respiratory rate and observing the respiration or the rhythm of your client. Observe for the rate, the rhythm, the depth, okay, is there presence of shortness of breath, the effort of breathing, hirap bang huminga si patient. Make sure to obtain the rate without letting the patient know. That's why, sabi natin, habang kinukuha mo yung kanyang pulse rate, huwag mo munang bitawan yung iyong kamay dyan, and bilangin mo na yung kanyang respiratory rate. Okay, you can write the result later kasi kapag conscious si client habang kinukuha mo yung kanyang respiratory rate, probably you will get an inaccurate result. Okay? So for the normal adult, the normal result or the normal respiratory rate is usually from 12 to 20 breaths per minute. You have to count the breath for 1 full minute. Remember, yung 1 breath, it includes 1 inspiration and 1 expiration. Okay, inhale, exhale. So part of your vital signs taking is to take the temperature of your client. Please note that according to researchers, the most accurate core body temperature is the blood temperature from the pulmonary artery. However, of course, in taking the temperature of our client, we won't be using invasive devices or monitoring device. So, according to Bates, the tympanic membrane temperature is the most reliable core body temperature because you can measure it without invasive monitoring device. Yan, you can use your digital thermometer or your infrared thermometer. So the tympanic membrane is usually supplied with blood vessels that supply the hypothalamus. Okay, the same blood vessels. We know that the hypothalamus is the body thermoregulatory center, or your hypothalamus regulates your body temperature. And remember also that the temperature fluctuates throughout the day. So, depende kung ano yung climate. So, the average temperature depends on the method used. Okay, for the oral, ito yung average, 37 degrees Celsius or 98.6 degrees Fahrenheit. For the rectal, okay, the average is 37 to 0.4 degrees Celsius to 37.5 degrees Celsius. While the axillary, the average is 36 degrees Celsius or 97.6 degrees Fahrenheit. So as you can observe, the oral temperature is lower. No? Usually lower siya ng 0.4 versus sa rectal. While the rectal naman is higher. Okay, higher ang kanyang temperature compared to the axillary. Yan. So, those are the range for hyperpyrexia. Okay, more than 41.1 degrees Celsius or 106 degrees Fahrenheit. And for hypothermia, if the temperature is less than 35 degrees Celsius or 95 degrees Fahrenheit, taken rectally. Okay, so this figure shows the temperature of the patient. Depende kung nasaan si client. Okay, for the cool ambient temperature, so you can see, no, yung core temperature. Ito yung core. So, malamig yung mga parts na walang red. Okay, for warm ambient temperature, ayan. So, umiinit talaga yung whole body of the client. So, there are options available for obtaining temperature of your client. You can use oral. Actually, the oral temperature is not recommended for unconscious client or restless or patients who cannot close their mouth because yung result might be inaccurate or it might cause injury to your client kasi unconscious siya. We have also the rectal, the tympanic membrane, and the temporal artery. Usually for the tympanic membrane and the temporal artery, we will be using the infrared thermometer and also the axillary. So this is an example of how to use the infrared, no? For using an electric tympanic thermometer, you have to place it on the ear, no, in the opening of the ear or the ear canal. Moving on, please take note of the following terms: the fever or pyrexia, which refers to abnormal elevation in body temperature. Hyperpyrexia refers to extreme elevation in temperature, usually higher or above 41.1 degrees Celsius or 106 degrees Fahrenheit. Okay, another term, hypothermia. This refers to abnormally low temperature, usually below 35 degrees Celsius or below 95 degrees Fahrenheit. So, another term under your temperature is chills. Okay, this refers to the feeling of cold or shivering. This might be a sign of infection or bacteremia. So, night sweats, okay, feeling hot and sweating accompany a falling temperature. So, sometimes it occurs with tuberculosis and malignancy. So, nagkakaroon sila ng night sweats, pinagpapawisan sa gabi. That could be a sign of a TB. Yeah. Okay, so let us now proceed to the fifth vital signs, which is pain. So, pain is the most common symptoms prompting healthcare. So, the International Association for Study of Pain defines pain as an unpleasant sensory and emotional experience with actual or potential tissue damage. So there are two types of pain, the acute and the chronic pain. So again, pain is one of the most common symptoms and often under-assessed and under-treated. So hindi natin masyadong napapansin at hindi siya nabibigyan ng tamang lunas. Okay. So again, there are two types of pain. The acute pain that occurs suddenly with recent injury or illness. Like for example, yung acute appendicitis or may accident. Yan. So may trauma. So kaya may acute pain. Chronic pain. This refers to the pain that persists for more than 3 to 6 months. Okay, usually ito yung pain na nararamdaman ng mga patient with cancer. Yan. Hindi naman lahat cancer, di ba? Or meron siyang chronic pain na matagal na, no? Usually yung chronic pain is tolerable naman. Okay? Recurring at interval of months or year. Okay, so again, hindi naman lahat ng chronic pain is malignant or cancer. Okay, meron lang siyang chronic pain, probably yung may mga arthritis din. Yan, may chronic pain din sila. Okay. So part of your assessment or the method of assessing the pain of your client, especially during a patient's history, you have to use your old card. Okay, you have to ask your client the onset or when did it start? Or when do you start feeling the pain? Kailan ba? Okay, the location where it is located. Is it in the upper, in the lower? Is it in the right or is it in the left? Especially if the patient is complaining for abdominal pain. Okay, what is the duration? Did it last for more than 2 minutes, 3 minutes, or more? What is the characteristics? Is it sharp, burning, or dull? What are the associated manifestation? Okay, when you feel the pain, is it associated with anorexia or feeling po ba nasusuka or naduduwal? Or may lagnat bang kasama kapag nagkakaroon kayo ng pain? Okay, and etc. What are the relieving factors? Nare-relieve ba yung pain through breathing exercises, through exercise? Okay. What are the treatments? You have to ask also for over-the-counter medicines, or you have to ask for alternative medicines that was used by the client. Ano na yung mga nainom niyang medications? Okay, kung naging effective ba ito or not. Okay, health disparities. Okay, ano ba yung gamit niyang analgesias? Be aware also of your communication techniques, lalo na kapag yung mga healthcare worker natin nagkakaroon ng ginagawa natin general lahat, no? Yung pain na nare-relieve lang sa ganito, general. So, i-avoid natin yon to be able to manage the pain immediately. So, there are types of scales to assess the pain of your client. You can use the visual analog scale. Actually, it's a horizontal, parang ruler lang yan. Tapos, meron siyang it is calibrated. Numeric rating scale and the verbal pain rating scale or a combination of pain scales. Okay, so yun yung gagamitin natin to assess the client pain. Okay, this is an example of your visual analog scale. Okay, it is calibrated. You might want to ask your client not to point, no, ituturo niya kung saan dyan yung pain niya. So, 0 as no pain, tapos yung 100 mm is the worst pain ever that she or he experienced. Or, pwede rin, ito yung pain assessment tool na merong mga facial expression. Okay, merong none, 0, no pain, tapos mild, moderate, and severe pain. So, pwedeng ituro ni patient yan, especially kapag yung patient is unable to read. Okay? So, another example of your pain scale Okay, again, 0 was no pain and 10 is the worst pain. So it is also divided into no pain at 0, tapos mild, moderate, and severe pain. Again, if your patient is a child, you can ask your client to point on the facial expression. Yan, kung gaano kasakit yung kanyang pain. So an example of your physical examination data, general assessment, conscious, coherent, oriented to time, place, and person, not in cardiorespiratory distress. So meaning, normal ang ating patient. The vital signs, okay, the BP, 120 over 80 millimeter per mercury. Heart rate, 88, okay, beats per minute. Respiratory rate, 16 breaths per minute. The temperature is 36.7 and no pain or not in pain. Okay, so moving on to the different types of pain, we have what we call the nociceptive or somatic pain, which is related to tissue damage or kapag may sugat or merong injury. Okay, this is usually acute and limiting, or it can be chronic and persistent. It is mediated by the afferent A delta and C fibers of the sensory system that respond to a noxious stimuli and is modulated by both neurotransmitters and psychological processes that causes the feeling of pain. So another type of pain is what we call the neuropathic pain, which is related to direct injury of the peripheral nervous system or the central nervous system. This may become independent of the inciting injury, becoming burning, lancinating, or shock-like in quality, and persisting beyond healing from initial injury. The central nervous system, brain and spinal injury from stroke or trauma may experience what we call neuropathic pain. So another type of pain is the psychogenic and idiopathic pain. Psychogenic refers to many factors that influence the patient's report of pain, usually psychiatric conditions like anxiety or depression, personality and coping style, cultural norms, and social support system. So may problem doon. So idiopathic is pain without identifiable etiology. So mahirap siyang hanapan ng cause talaga. Okay, so managing pain of your client can be complex and challenging, especially for us, nurses. It's really difficult, But of course, treatment of pain requires sophisticated knowledge on non-opioids, opioid, and adjuvant analgesics and modalities of behavioral and physical therapy, which actually help manage the pain. But as a nurse, you have to focus on the 4 A's to monitor the patient outcome. Okay, analgesia or the effect of the medicines. Does it help the pain? Does it reduce the pain of the client? How about the activities of daily living? Okay, nakabalik na ba siya sa kanyang function? If before the client can't go to work or can't attend the class because of pain. Okay, so nag-decrease ba yung kanyang pain scale? Able to perform na activity of daily living. Adverse effect, okay? When taking the medicines, nagkaroon ba ito ng allergy? Pagka nagkaroon ng allergy, naka-experience ba ng shortness or difficulty of breathing? So that is an adverse effect. Example. Okay, aberrant drug-related behavior. So, ano ba yung kanyang naging effect nito sa kanyang behavior? Okay, so again, your pain management, ito yung mga nakakapag-effect or nakakapag-help to manage the pain. Of course, the medicines, the nerve blocks, that help ease the pain, lifestyle modification, particularly for patients who have stroke, physical therapy, so it helps. So, in recording your findings, make sure to use vivid and graphic adjectives. to describe your findings. Avoid cliché, and you have to record vital signs taken at time of examination. Kindly see example on page 142 of your Bates book. So for health promotion or health teaching, particularly for the temperature, okay, you have to educate your patients on various routes, okay, like for example, axilla, oral, rectal, okay, how to correctly obtain temperature and the correct use of the equipment. You have to educate your patient on risk factors for hyperthermia and hypothermia. Okay, for the pulse, some medications require checking the pulse before administration. So make sure to tell your client if your client is taking cardiac medication, dapat mag-take muna siya ng pulse rate before taking that medication and observe niya yung kanyang pulse rate. Teach patient how to check one carotid pulse. Okay, paano ba i-check yung carotid pulse? Actually, that will be discussed further in our next discussion. For respiration, educate the patient on how to count properly. Of course, that includes the inspiration and expiration. One count lang yun. Record the rate, rhythm, and amplitude. Okay, ano ba yung rate? Normal ba? Yung rhythm? Wala bang difficulty of breathing or shortness of breath or shallow, yung deep ng breathing. So for blood pressure, ensure the patient is using the correct cuff. For home sphygmomanometer, it should be checked periodically to ensure accurate readings. Baka hindi na accurate ang reading nito. Encourage the patient to keep a journal to record readings. Dapat may notebook siya na susulatan niya ng kanyang readings or vital signs. This ends our presentation or topics for this week. This is the reference of my presentation. Have a nice day and God bless.